Dr. Scott Brannon. I'm a specialist in peripheral arterial disease. I'm here today to inform you a little bit about the disease, its prevalence, its causes, the risk factors for the disease, and then to promote awareness amongst those who may be at risk. So peripheral arterial disease is a disease that affects the arteries outside of the heart. So that may be the arteries of the neck, the carotid arteries, maybe the arteries of the leg, or below the knee in the calf or in the foot. The prevalence of the disease is greater than what you might expect. Depending upon the data set that you analyze, the estimated prevalence is between 15 to 20% for patients that are 60 or older. Once we get to the age group of 80 or older, that prevalence rate jumps as high as 40%. Now, if we compare that to the number of people who know about PAD, estimates are that approximately 1 in 5 people have ever been familiar with the term peripheral arterial disease. So our goal is to promote a little bit better understanding amongst the population that might be at risk. So what are the risk factors for PAD? One of the number one risk factors, as we've already identified, is age. Another very important risk factor, probably the second most important, is diabetes. And that's for diabetics that are newly diagnosed, but most importantly for those who have had diabetes for 10 years or longer. Another extremely important factor is any history of smoking. Even if you quit smoking, if you smoked for a total of 10 years or more, you have a significantly higher risk of developing peripheral arterial disease. Other risk factors such as high cholesterol and high blood pressure are also very important determiners of who will develop this disease. Now, when the disease initially presents, it's a silent disease. There really are no symptoms early on that your arteries are becoming stiff and narrow. Usually, it's not until you've engaged in vigorous activity that your body will start to tell you that it's not getting enough oxygen to the tissues. And the way classically that we know of that presents is with cramping in the calves, ankles, or foot when someone is walking or running, particularly walking or running on an incline. And when that person sits down, that pain goes away. That is the classic definition for claudication, which is the cramping that you get with exercise that goes away when you sit down. Now, the next level that we have to do in the analysis is how at risk are you as an individual? Well, if you have any two of the major risk factors that we talked about before, either age greater than 55, or diabetes, or smoking, or hypertension, any two of those, and you are at considerably increased risk of peripheral arterial disease, and you should definitely be screened. The screening for peripheral arterial disease is very simple. We bring you into the office, we do an evaluation of your medical history, the current medications that you're taking, we do a physical examination, take off your socks and shoes, look at your feet, evaluate your pulses, and then we usually perform an ultrasound evaluation to look in real time at the velocity and the quality of your blood flow. When we have a reduction in the caliber of a vessel at 50% or greater, we know that that reduces the velocity and the force of the blood flow sufficiently to cause symptoms. And so in those cases, we will go in and perform a minimally invasive treatment to help open up that artery. This is not a treatment that requires admission to a hospital. This is not a treatment that requires anesthesia. This is a treatment that can be very simply and safely done in an outpatient environment through a pinhole access. In fact, many of the patients that are afraid of the pain, I'll make a deal with them that we don't even bring a scalpel into the room. We do everything just through a needle. And recovery is about 1 hour. And then you're able to go home after the recovery period and return to normal duties within usually 24 to 48 hours. So it's a disease that's easy to screen for, easy to evaluate, and easy to treat. But it kills 8 times more people every year than breast cancer. And it has its own month and it has its own ribbon, but nobody really knows what that is. And that's what we're trying to do here, is to increase the community awareness of the disease and to encourage you guys to look out for these early warning signs, evaluate your risk factors, talk to your primary care provider about it. And if there's any question that you have at all, give us a call. We'll get you scheduled and we'll screen you for the disease.